100% of our net proceeds are going to go to two organizations. One is Live Strong Foundation, and the other is Cancer Care Point in San Jose. I chose Live Strong Foundation because the website produces a wealth of information for a cancer patient and their supporters, especially when you're new to this disease. So when I first was diagnosed, it was overwhelming. A lot of friends and family, colleagues reached out to give me ideas and support, and it was coming at you at all directions. And there's a side where you need to look at your medical care as well as your health, how to manage yourself during chemo, and what are the good foods to eat. And I would get things like, you should eat lemons, you should have oranges, you know, ginger is good for you, the tree bark of this certain tree is good for you. And I would always look up cancer and tree bark, cancer and lemons, and there's a lot of sites out there. Some are good, some are not as good, but Live Strong was always showing very consistent information, and I appreciated that. It made me feel more confident about the decisions I was making. In addition to that, they also have some free workbooks around, it's a guidebook on planning your health care around cancer, what to do when you're first diagnosed, how to approach your doctors, how to get into clinical groups, and aftercare also, or aftercare or care while you're going through chemo, and what to do when you're done and through the later stages. And those were helpful as well. It was very generic, but it was nice to have something guiding me through. So the other charity is Cancer Care Point. They're located in San Jose, and it's a relatively new organization, and they will take patients from anywhere, regardless of what your medical affiliation is. So if you go to Stanford or Blue Cross Blue Shield, Kaiser, Blue Anthem, anyone, they will take all cancer patients and all cancer supporters. And when I was first diagnosed with colon cancer, I could not, people ask me, do you know what happened? How come you have it? And I look at the risk factors, and I'm not, I exercise regularly. Last I checked, I'm not obese. I'm not smoking, I'm not drinking. But the one thing that hit me that is very much what I do is a diet low in fiber and high in fat. And I'm convinced that it was my diet that caused this. I had the mentality that I could eat whatever I wanted, whenever I wanted, and I needed nutrition help. I found it through Cancer Care Point. They offer nutrition services from, I guess, accredited nutritionists who put together your cancer care with the type of nutrition that's good for you. And they offer the service free, so it's not like I didn't have to go from nutritionist to nutritionist, forking out $80–90 per visit till I found the right one. I actually had a 2-on-1 consultation where they got my history, they requested my blood tests, and one took notes on what I should do, and the other made a shopping list for me. And I've got a follow-up appointment with them as well. So they've been really helpful in helping to guide me in that direction.